Tell me a little bit about yourself and your practice and the population you serve.
Okay, Aryeh Leib Ecker. I live and work in Kew Gardens Hills, Queens. I have a private practice, and I see adults, individuals, couples.
Okay, what are some of the most common issues that you seem to be seeing in the community today?
Lots of different things. I see couples oftentimes who are just struggling to see eye to eye and not to fight all the time. So I try to help them have more productive conversations, learn to tolerate other people's feelings and point of view so they can get along better, so that they don't cause each other to be so reactive. I see individuals who are struggling with the results of complex trauma, so they are not functioning at the level that they may want to or could potentially function at, and often they show up with symptoms of depression or anxiety, a lot of anxiety.
Yeah, so what are some challenges that you feel you have as a clinician that would be beneficial for you to have to have the best practice for your clients?
What challenges?
Yeah, so it's I guess a tough question. A vulnerable question, but sometimes
What are my challenges?
Yeah, or what do you think clinicians' challenges are really to properly help their clients? Like lack of it.
Sometimes we feel like we have to save our clients, or like that we can rescue them in some way. Like I think sometimes we fail to remember that that it takes a while. It's a process, like we're not the only ingredient in their recovery or in what they do. Like they come to us once a week for 50 minutes, and we try to give them support and maybe some direction and insight and maybe some tools to get along in the world, and then they go out and they have to
survive till the next session.
Yeah, execute and survive till the next time. And along the way, they run into a lot of obstacles. So and then they come back to us, and I think if we're thinking like we have to jam everything into this 50-minute session so that they have what they need for the week, I think we're setting ourselves up for...
Right, it puts the pressure on us.
You can feel a lot of pressure.
Okay, and that's a very valid point. And I think really in an environment like this, what we're doing right now is a good message to share to other therapists to be mindful of that.
Right. And it helps the therapist to relax and be more present.
Right.
You can your fight or flight reflexes
responses,
and your nervous system can relax. You can use your thinking brain to be there with the person, and that's when you're operating as your best self.
Great. And what modality do you primarily use?
I use a lot of emotionally focused therapy, EFT.
Okay, EFT, yes.
Yeah. I also am a big fan of David Burns, who is a pioneer in CBT, but he has
with a twist.
He twisted it. He calls it Team CBT.
Yeah.
And what differentiates Team CBT from regular CBT is that it addresses the client's resistance. So he says that the biggest obstacle to getting clients to change is their resistance to change. So the first thing what Team CBT does is it melts away the client's resistance. So I use that oftentimes, especially with people with a lot of negative thinking, a lot of anxiety, depression. I see a lot of people with chronic pain and chronic symptoms.
Yeah.
Well, no, not that, but I use like trauma informed therapy, like mind-body therapy.
Okay, yeah, that works. Yeah, that does. Yeah.
Yeah.
Okay, great. So some of the things that I wanted to talk about actually is what Essence does for clinicians. So a lot of the challenges, logistical challenges therapists have is being able to be present for their clients while having to run a business, in essence, really. So what Essence provides is a therapy space, scheduling, and back office management, billing, and everything that goes into, making the appointment happen, as well as referrals, trainings, supervision, social media, marketing, podcasts like this to promote the therapist. So really,
It's like a Google for therapists.
So yeah, it's really everything for it's really everything for the therapist.
Yeah.
So they can actually sit and actually focus on the therapy.
And a lot of support.
Yeah, it's the support. So
Yeah.
that's what I do here.
Very nice.
Yeah.
Yeah.